Yes, there are a proportion of people who seem to be more prone to acid reflux. We do know that diet and lifestyle play a role in acid reflux. And so those who tend to have, for example, higher intake of caffeine, spicy foods, fattier foods, or acid-rich foods, they can be more prone to symptoms of acid reflux. Also, there are a proportion of patients who have quite stressful lives, and we know that stress can bring on acid. And in those sorts of patients, acid reflux can also be more of a symptom. We also find that patients who are overweight can have more symptoms of reflux disease from additional pressure on the abdomen, causing acid to go back up. So diet and lifestyle plays a huge role in acid reflux and the symptoms, and also in the management. Bouts of reflux can be exacerbated by a change in diet or lifestyle. So we've already mentioned that there are certain triggering factors for acid reflux. Some people find that if they have been having what is perceived as an unhealthy diet for a period of time, so maybe over Christmas period when they're eating more than they would normally, or eating more rich food or spicier foods, then that can bring on bouts of acid reflux. Also, during times of stress, we know, as already mentioned, that stress can cause you to produce more acid. This can also cause more symptoms or bouts of reflux during that period of time. So acid reflux is a really common condition, and lots of patients take over-the-counter remedies, antacids, sometimes things like omeprazole over-the-counter to try and help their symptoms. I think you need to see your doctor if your symptoms persist despite these treatments, or if it becomes something that you're reliant on. So if you need to take these medications on a regular basis, then you should seek medical help. If you have symptoms of regurgitation, food getting stuck, or vomiting any blood, then those are obviously times when you should seek medical help immediately. So we know that acid reflux can be precipitated by having foods that are high in acid or make you produce more acid. So reducing caffeinated drinks, fizzy drinks, carbonated drinks, alcohol, smoking, those can also all help with things. Also, we also suggest, rather than eating infrequently or eating big meals, eating small meals more frequently throughout the day can help regulate acid and mop up the acid that we produce all the time. So I'd normally recommend, if you're suffering with acid reflux, if you can, to try and have 5 or 6 smaller meals throughout the day. Also, to try and prevent symptoms overnight, it's important to try and eat your last meal a few hours before you actually go to bed, because obviously lying down will mean that acid is more liable to go back up and cause your symptoms. Also, stress plays a huge role in acid reflux, and so looking at mindfulness and getting at stress management can often help reduce the acid that is produced as well. Acid reflux is treated with diet and lifestyle modification. Often patients need to take medication such as omeprazole or lansoprazole, which help reduce the acid in your tummy. Normally a course will be for 4 to 8 weeks, and then titrating down or stopping as your symptoms allow. A proportion of people need to take these medications longer term if needs be due to ongoing symptoms. We often look for a bacteria called H. pylori as well, which can often exacerbate symptoms of acid reflux. And if we find this bacteria, it can be easily eradicated with a week's course of antibiotics and medications such as omeprazole. In a proportion of people who have ongoing symptoms despite the medications, or become reliant on these medications and don't want to be, then there are options such as surgery or procedures that we can do through endoscopy, through a camera, to try and help relieve those symptoms. But these patient numbers aren't huge, and if we can manage things through diet and lifestyle modification and a short course of medication, then we prefer to do things that way. But there are certainly surgical options that can be used if needs be.